We are covering the 10 essential health benefits under the Affordable Care Act, a critical topic for your National Health Insurance licensing exam. The ACA mandates that all individual and small group health insurance plans must cover a core package of services. This ensures a minimum standard of comprehensive coverage and prevents insurers from selling bare-bones policies that leave consumers vulnerable. The exam will test your knowledge of which plans this applies to and what the categories of benefits are. A major exam trap is to assume these rules apply to all plans. Remember, the EHB requirement is specifically for non-grandfathered individual and small group plans. Large group plans and self-insured plans are generally not required to offer all 10 EHBs, though if they do cover a service from an EHB category, they cannot place annual or lifetime dollar limits on it. The 10 categories are ambulatory patient services, which is outpatient care, emergency services, and hospitalization. Next are maternity and newborn care, and mental health and substance use disorder services. Then, there's coverage for prescription drugs, rehabilitative and habilitative services and devices, which help people recover or gain physical and mental skills, and laboratory services. Finally, the list includes preventive and wellness services and chronic disease management, along with pediatric services, which must include both dental and vision care. A common point of confusion is the distinction between rehabilitative services, which help you regain a skill you lost, and habilitative services, which help you learn a skill for the first time. The exam might present a scenario where a plan denies coverage for a service clearly within one of these 10 categories. For instance, if an ACA-compliant individual plan refuses to cover hospitalization for a major surgery, that would be a violation. Another key point for the exam is that while the 10 categories are federally mandated, the specific services covered within each category can vary by state. Each state sets its own EHB benchmark plan, which acts as a model for all other individual and small group plans in that state to follow. One of the most frequently tested concepts is cost sharing for preventive care. While most essential health benefits are subject to deductibles, copays, and coinsurance, many preventive services, like specific screenings and immunizations, must be covered with no cost sharing. However, a trap to watch for is the difference between preventive and diagnostic care. A routine screening mammogram might be free, but if it's done to investigate a lump, it becomes diagnostic and normal cost-sharing rules will apply. To remember the 10 categories, use this phrase: all eager hippos must munch purple raisins and large pretty peppers. This stands for ambulatory, emergency, hospitalization, maternity, mental health, prescription drugs, rehabilitative and laboratory, preventive and pediatric services. The exam expects you to understand the application of these benefits, not just list them. Focus on which plans are included, the no cost-sharing rule for preventive care, and the role of state benchmark plans. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.